10 worst and the 10 best parts about being a nurse. Welcome back to my channel. It's so great to see all of y'all. My name is Anessa and I've been a nurse for 3 years. I became a nurse during the pandemic in 2020 and I've been in psych the whole time. But I will also give you some insight over my close friends that have been nurses in like hospitals and who've also gone to the nurse practitioner route as well. I will start with the 10 worst things about nursing and what it's like. And this is in no particular order. Number one is that you will have long shifts. So usually in nursing, you have about, especially when you first start in bedside, you have about 12-hour shifts. And I know what you're thinking. Oh my God, you only have 3 shifts a week. You get like 5 days off. That's amazing. However, those shifts are 12 hours long, and sometimes it's very, very difficult. For me, living in Texas, I work at a psych facility, so sometimes I even work 16 hours straight. And oftentimes you don't even get 30 minutes to yourself to eat lunch. So you're working 16 hours straight continuously. In that aspect, I mean, 8 hours is what everyone else works, but the 12 hours can get really, really long. So that's what I would say is kind of one of those things where you either hate it or you love it. Me personally, I don't love it. The next thing is that you are going to be working with so many different types of people in all different ages, and you will have so many difficult patients. Being a psych nurse for 3 years, I have had so many types of patients. I've had patients yell at me. I've had parents yell at me. I've had patients hit me, kick me. I've had to do so many things that I never thought nursing was about, unrelated to medication. Next is the physical demand of nursing. A lot of the times for those 12 hours outside of your lunch break, you are on your feet juggling 4 to 6 patients on the floor if you're in like a medical field. If you're in psych, you have up to 20 patients on a unit by yourself that you have to be responsible for. Don't think you're gonna get that much time to like sit down and relax, because you're gonna be constantly working and constantly on your feet. I mean, that's great because you get your steps in, but again, you have to be ready for the physical demand of the job. Next up is the emotional integrity that is required to be a nurse. Because let's face it, you will have patients that, depending on your specialty, you might be giving CPR to, that might be dying, and then in the next room over, they might just be asking for water and pain pills. Both are very relevant and very important, but you gotta understand, you have to put on a face and you have to be professional and you have to be the comfort for every patient, and for every patient it's gonna look different. At the end of the day, you may have had 2 patients pass away and 3 patients make it, but you have to put on a good face. And that is extremely hard, but it's a really good skill to acquire as a nurse. Next up is dealing with very aggressive patients. I personally work with children, and yes, in my field, I have been hit, spit at, all the works working in psych. It hasn't bothered me that much because the good outdo the bad, but you have to be prepared to deal with aggressive patients. It's part of the job, it's part of the gig. Next up, I think it's a very obvious one, is your exposure to germs. We do our best to control the infection in hospitals. We wear our correct PPE, we wear our correct gear, right, to prevent us from being sick and take the correct precautions according to the CDC. But sometimes, no matter how hard you try, you do get sick. Me personally, I have gotten COVID from work. I have gotten strep throat from work. I have gotten the whole works that maybe otherwise I wouldn't have gotten. So that's always a risk as well. Number 8, you will probably be working holidays, if not one year, the next year. So as a nurse, especially working in bedside, you are not exempt from working holidays. So there's a lot of times when you miss family events, and that's really hard. Number 9, like I said, I became a nurse during 2020, and that's exactly when the peak of COVID hit. It's really extremely hard being a nurse at that point because you were exposed to COVID as a baby nurse, and you've had to do so many things outside of exactly where you were taught in nursing school. But you gotta understand, there's always gonna be a new pandemic or epidemic or new disease that you may not be completely familiar with, but you have to be professional and you have to be willing to take on the task. Number 10, a lot of the time, especially in bedside, you are exposed to patients that are really sick. A lot of them do not make it. I don't know how many friends that I have in the nursing field that have had code blues on patients that they really cared about and that did not make it. And that really does change how you feel and how you are as a nurse and as a person. I do want to move on and talk about the top 10 best things about nursing. So the first part about nursing, whenever I talk to somebody who doesn't know exactly what they want to do with their careers and they want to get into healthcare, I tell them to go into nursing. And you know why? It's because with nursing, your degree is so flexible, right? You can either go into education, you can go into research, you can go into teaching, you can go into bedside, you can even get more experience and go into an APRN career. So you can be a nurse practitioner, you could be a CRNA, so that's a certified registered nurse anesthetist. And honestly, there's just so much more that I haven't even uncovered, right? So the flexibility in the nursing career is unparalleled, and you could always move up and do whatever you want. Me specifically, I'm in psych nursing and I have chose the administrative route. So I work in admin in my facility. So it's completely flexible and so amazing. It's such a good career. The next thing that I love about nursing is that you could really choose your specialty. You can go into ICU, trauma, ED, med-surg, NICU, labor and delivery. Like the possibilities are endless, and you can also specialize in those careers by getting a certificate or going more back into school. So regardless, it's always such a safe and such a great route to get into. So next up, one of my favorite parts about nursing is the fact that I actually get to work with other people, other living beings, people with real emotions. I don't think I could have done nursing if I had to sit behind a desk the whole time. I love interacting with other people, and you never know who you're gonna come across, and you learn so much about yourself by interacting with other people. So if you're a people person, nursing really is a job for you. And along with working with people, number 5 is that you really get to care for them. I really don't think there's anything more fulfilling than caring for people, especially when they're so grateful. I will never forget like all the patients that I have worked but then come in contact with that have always said, Anessa, you're my favorite nurse. You're the reason why I keep going in this facility. I've never forgotten it. Honestly, sometimes I'm so grateful for the path that I chose. Also, number 6 of why I feel like nursing is so amazing is that you can travel. I have friends that started traveling 2020, 2021 across the world, literally halfway across the world, and they have made 1, so much money, 2, paid off so much debt, and 3, have made so many experiences in the opposite side of the world. Number 7, and that goes hand in hand with the travel nursing, is the financial stability that you get with nursing. This is one of those careers that no matter where you go, you know you're gonna make money. No matter where you move in this world, everybody needs nurses. So it doesn't matter where you come from or what specialty you're in, there's gonna be a job for you in every city, every town that you wanna go to if you're willing to do the work. So speaking of the flexibility of nursing, number 8 is the fact that especially if you're in bedside, you can do 3 days of work and 5 days off. And I have known so many people, including myself, where they'll do 6 shifts in a row and then take a week and a half off for vacation without having to use PTO or cut down on their hours. You can really make up your own schedule and have a vacation that is completely paid for. Me specifically, I will work a couple weeks in a row and then I'll have a couple weeks off, and it is absolutely amazing. The last 2 points that I want to make, number 9 and 10, is that first, the work you do really matters. The impact that you'll make on people and patients and children as your time as a nurse is unparalleled because you spend more time with those patients more than anybody else in the hospital. I think about the time that my sister was delivering her second child, and she was so grateful towards her labor and delivery nurse and her postpartum nurse that she bought them gift cards, and she still remembers their name to this day. And I think it's just so important to remember the impact you make on other people. Last but not least, in addition to a point that I made, is that with nursing, you can travel anywhere in this world. Anywhere. Like, you are not tied down to one place. And if at any point you get bored, you either go back to school or start a different specialty. Travel nursing is such a crazy hack. And not to mention the amount of money that you get. I've had my friends buy cars in cash just by travel nursing. Go nuts with. So everybody, thank you so much for watching. That is the conclusion to the top 10 worst and top 10 best parts about being in nursing. This is Anessa, and don't forget to subscribe, and thank you so much for watching.